Alright, so I start this test by saying, hello, my name is Kendall, what's your name? And then I would shut the door for privacy. I will be taking resting measurements of heart rate and blood pressure while standing, because it's a treadmill test. Some values of safety: we ask that the client straddles the treadmill before the test begins. We ask that they look straight forward, try to remain on the front portion of the treadmill, and that they do not hold on to the handlebars if possible. Now, heart rate and blood pressure will be monitored throughout the whole test, and the workload, meaning the speed and grade, will increase periodically. I will ask the client how hard they feel that the workload is at the last 15 seconds of each stage. I'll do this by using the RPE scale, which goes from 0 to 10, 0 being that this is the easiest thing, you're at rest, 10 being that this is the hardest thing, hardest physical work that you've done. The number should be representative of how the participant feels overall, and not how they feel in a particular portion of the body. Now I'm going to ask if they have any questions about the RPE scale, and if they don't, we're good to go. On to informed consent. I would let the client know that they have the right to stop the test at any time. All they have to do is let me know so I can slow the treadmill speed immediately. And I would ask them that they do not jump off. I asked them also that they report any unusual signs or symptoms, like chest pain, lightheadedness, dizziness, etc., immediately when they arise. Now, stage 1 will be set at 1.7 miles per hour at a 10% grade for 3 minutes. I'll record heart rate at the first and last minutes of this stage, and I will take blood pressure at the last minute and 30 seconds of this stage. I'll ask what the RPE is at the last 15 seconds of this stage. I will again use visual and verbal monitoring to assess for any unusual signs and symptoms. I'll do this by asking the client how they feel and looking at them periodically. Prior to this stage ending, I will give the client a warning that the workload is about to increase. And then when stage 2 happens, I will repeat this protocol, and I will repeat it for each subsequent stage. Now, stage 2, the protocol is actually, it's at 2.5 miles per hour at a 12% grade. Stage 3 is at 3.4 miles per hour at a 14% grade. And stage 4 is at 4.2 miles per hour at a 16% grade. These all, again, will occur for 3 minutes. Now, for recovery, I will set the workload to 1.7 miles per hour at a 0% grade, and I will decrease speed first and then grade. I will take an immediate heart rate in the first and second minutes of this stage. I'll do the same for an immediate post-exercise blood pressure in the first and second minutes of this stage. I will use, again, appropriate visual and verbal monitoring to assess for any unusual signs or symptoms by asking the client how they feel and looking at them periodically. Now, after the second recovery blood pressure is finished, we will safely stop the treadmill by having the client hold on to the handrails. We will then slow the treadmill before coming to a stop. We ask that the client remains on the treadmill until the belt is at a complete stop. We will have the client sit after the recovery stage is over, and then about a minute into this sitting, we will take a final heart rate and blood pressure to ensure that vitals are back at baseline. Now, 3 signs or symptoms that may indicate test termination would be fatigue, claudication, leg cramps, and oxygen saturation of 80% or less, because we typically function at 98 to 100, and increasing chest pain, that angina feeling. And then I would thank them for their time and participation. And that's all.